Oops, sorry. The hearing will come to order. Today's hearing will examine gaps in disaster management that cause people with disabilities and older adults to be overlooked. Whether it's hurricanes or wildfires or the next pandemic, people with disabilities and older adults must have a seat at the planning table. This hearing is particularly timely for a state like Pennsylvania, which has suffered through devastating floods and tornadoes just this summer, spawned by the remnants of Hurricane Ida, of a record-setting Atlantic hurricane season, part of a record-setting hurricane season. This hearing also comes after more than 190 nations reaffirmed their commitment to take into account the needs of people with disabilities at the Glasgow Summit on Climate Change. People with disabilities and older adults are often the ones hardest hit by disasters, but they're not given a voice in the management process. The 2018 Camp Fire in California serves as a stark reminder of this fact. The Los Angeles Times reported shortly after that fire that 53 of 69 deaths were to people over the age of 65. To ensure the safety of people with disabilities and older adults, they must be included in each phase of disaster management. That means in the preparation phase, response phase, the recovery and mitigation efforts that are undertaken. That's why I've introduced a piece of legislation to deal with some of these issues. It's got a long name, the Real Emergency Access for Aging and Disability Inclusion for Disasters Act, or the READY Act, R-E-A-A-D-I, READY. This is Senate Bill 2658. This bill would ensure that people with disabilities and older adults have a voice at every stage of disaster management. It would require accessible information about planning for disasters, making sure that that information is available to everyone, including those with disabilities. And it would make sure that shelters and temporary housing are accessible to older adults and people with disabilities. But it's not only natural disasters we need to be concerned with. The COVID-19 pandemic has made it clear that disasters are not limited to weather events. Roughly 1/4 of the 760,000 deaths during this pandemic have been in nursing homes or other long-term care facilities, where most residents are older adults or people with disabilities. The bottom line is we must continue to invest in bold policy solutions to save lives and strengthen communities. The Build Back Better bill will include a once-in-a-generation expansion of home and community-based services that is based upon a bill that I introduced, the Better Care, Better Jobs bill. And what we're trying to do there is to create better jobs for those who are doing this important work, home and community-based services work, better care for seniors and people with disabilities who are served, and better support for family caregivers. These investments will mean better preparation for disasters and emergencies. Today we will hear testimony how better access to home and community-based services can help save lives during a disaster. We'll also hear crucial testimony that people affected by disasters need to maintain their health care throughout the response and recovery phases of disaster management. The Build Back Better legislation and the recently passed infrastructure bill will make historic investments in reducing the speed and effects of climate change. All of these bills are a recognition of what the science is telling us, that climate change is causing natural disasters, the likes of which we've never seen before. Unprecedented weather, health, and man-made disasters make it necessary to have a whole community approach to emergencies. People with disabilities and older adults must have a seat at the table when we're doing that planning. As we often hear, representation matters, and in disability and aging communities, there's an old expression, nothing without us that is about us. Nothing about us without us. That should hold true for disaster planning as well. And I want to say to the Ranking Member Scott, before I turn to him, I'm happy to join you, Senator Scott, on your bipartisan FEED Act, Senate Bill 19, which would make it easier for small and mid-sized restaurants to provide nutritious meals to people during disasters.
Thank you, Mr. Chairman.
I thank you, and thanks for introducing the bill. With that, I'll turn to Ranking Member Scott for his comments.
Thank you, Mr. Chairman, first for your leadership on this committee, and second for joining the FEED Act, a very important piece of legislation that will help us tackle the challenges of food insecurity, especially during the height of disasters. Thank you to our witnesses for being with us today. Older Americans and people with disabilities are more vulnerable to natural disasters, and we must do everything we can to protect them. Mr. Chairman, I recognize how hard Hurricane Ida hit your state in September and how Pennsylvanians responded as they always do, with courage and with strength. In the Palmetto State, we are all too familiar with floods, hurricanes, and other natural disasters. Like so many other South Carolinians, I will never forget the 1,000-year flood in 2015. After those floods, we were hit the next year by Hurricane Matthew. We experienced tragedy and triumph. Folks like Janice and Gene Davis, a wife and husband in Hilton Head, represent the strength of South Carolinians during a response to a natural disaster. Gene owned an auto painting business. Janice was a caregiver to Joe Scott, an 88-year-old widow. When it became unsafe for Joe to stay home, Janice and Gene drove through the storm to pick her up. With the power out, streets flooded, and trees down, they drove Joe to her son's home in St. Louis, Missouri, more than 800 miles away. South Carolina has proven a leader in disaster management. The University of South Carolina's Hazardous Vulnerability Research Institute developed a tool that estimated a county's vulnerability to disaster. The tool, the Social Vulnerability Index, includes elderly persons and individuals with special needs. The index now includes all counties in the United States, and FEMA has adopted it in their National Risk Index. The first step in effective disaster management is, of course, prevention. That is why I introduced bipartisan legislation with Senator Schatz from Hawaii, the Repeated Flooded Communities Preparation Act. This seeks to provide more resources to those areas of our nation that consistently and continuously flood. They are flood-prone communities. The legislation would break the costly cycle of repeated flooding and rebuilding by providing our communities with the tools to take proactive steps to reduce flood risk and safeguard homes and businesses. But even the best preparation cannot stop every disaster. Once a disaster happens, we also need solutions to assist in those communities. That's why I introduced the FEED Act with Senator Murphy from Connecticut. I'm very thankful that our chairman has joined the FEED Act. The FEED Act would increase food security for older Americans and others during emergencies by opening up a pathway for food producers, restaurants, and nonprofits to partner with their state and local governments to meet the needs on the ground. It's through reforms like the FEED Act that we are able to assist local communities in the midst of a disaster. Lastly, we must also continue to work to improve post-disaster recovery. In South Carolina, as in many southern states, heirs' property is passed down by inheritance. In the wake of disasters, FEMA regulations had reflected unjust discrimination against those heirs, who are disproportionately poor and minorities because they simply can't afford to clear the titles. These homeowners have been ruled ineligible for the disaster assistance they should receive. This resulted in FEMA denying twice as many requests for disaster aid in majority minority counties as the national average. In August, Senator Ossoff and I sent a letter to Homeland Security Secretary Mayorkas urging FEMA to review and revise its practices. As a result, FEMA changed its policies in September. FEMA will now accept a broader range of documentation to prove home ownership and occupancy. such as receipts for home repairs or improvements, a long overdue correction of something was simply not right. I'm pleased with this progress and urge FEMA to do more to better support people in rural areas. The poorest homeowners, often in rural America, receive half of what wealthier homeowners do in home repair assistance. There's a 17-point gap between the denial of aid for higher income homeowners versus poor homeowners who tend to live in rural places like rural South Carolina. FEMA accepts 90% of disaster requests for 7.5 or of 7.5 million or more, compared to just 6% for requests of 1.5 million or less. While damages in more urban areas often easily reach $10 million, larger amounts of damage in rural areas do not often meet that total. I look forward to working with you, Mr. Chairman, as we look for ways to help our seniors weather the storm and be better prepared for the outcome that will be positive, especially for those who are also with special needs and disabilities. Thank you, Mr. Chairman.
Thank you, Ranking Member Scott. Because it's Thursday, because we've got a lot going on, there'll be senators in and out of this hearing and juggling hearings. I know the ranking member is one of those senators having to juggle two big hearings. We were joined and have been joined by Senator Braun of Indiana, Senator Rosen of Nevada, and Senator Rick Scott of Florida. Let me turn now to our witnesses. I'll introduce them one after another before their testimony. But our first witness is Dr. Sue Ann Bell. Dr. Bell is an associate professor at the University of Michigan, where she focuses her research on how disaster preparedness at the federal, state, and local levels can affect individual health outcomes following disasters. She is also a nurse scientist and family nurse practitioner who has worked on the ground responding recently to Hurricane Ida and, of course, the COVID-19 pandemic. Thank you, Dr. Bell, for being with us today and sharing your expertise with the committee. Our second witness is Dr. Wanda Spurlock, a professor in the College of Nursing and Allied Health at Southern University and AM College in Baton Rouge, Louisiana. Dr. Spurlock recently served as co-chair of a national policy expert roundtable on emergency preparedness for older adults. Her research focuses on disaster preparedness, response, and recovery for older adults, including the role of family caregivers and skilled nurses in disaster management. Thank you, Dr. Spurlock, for being with us today and sharing your expertise with the committee. For witness number 3, I'll turn to Ranking Member Scott to introduce our next witness.
Thank you, Mr. Chairman. It is my pleasure to introduce today Randy Creamer of Columbia, South Carolina. Randy is Vice Chairman of the South Carolina Voluntary Organizations Active in Disaster, known as VOAD. He is also the Director of Disaster Relief for the South Carolina Baptist Convention and member of the VOAD in the Palmetto State. For over 3 decades, Randy has served on the front lines to help respond to disasters in South Carolina and around the country. Randy serves with the South Carolina VOAD Executive Committee to enhance coordination among dozens of voluntary organizations, including Habitat for Humanity, the Salvation Army, and the American Red Cross. South Carolina VOAD is an affiliate of the National VOAD, which is an association of nonprofit and voluntary organizations striving to mitigate and alleviate the impact of disasters. Many American companies and corporations are partners and supporters of this network. South Carolina VOAD member organizations cover a broad range of missions and technical expertise. Volunteers lead in many aspects of disaster response and recovery, from preparing meals and starting amateur radio operations to removing debris and building new homes. Randy's testimony today will discuss the role of voluntary organizations in disaster relief and lessons learned from his decades of experience. Randy, we appreciate your leadership and hard work to help improve disaster relief for South Carolinians and your neighbors. Thank you for being with us here today. We look forward to your testimony.
Thank you, Ranking Member Scott. Our final witness is Ms. Danielle Kerner from Rutledge, Pennsylvania. Ms. Kerner has experience with disaster management in many different ways. She's, first of all, the mother of Joseph, a 9-year-old who lives with a disability, and previously she cared for her mother with early onset Alzheimer's. Ms. Kerner is also the volunteer management coordinator for the Delaware County Department of Emergency Services in Pennsylvania, in southeastern Pennsylvania. I want to thank Ms. Kerner for being with us today and for sharing her expertise with the committee. And so now we'll proceed to our witness statements. We'll begin with Dr. Sue Ann Bell. Dr. Bell, you may begin.
Chair Casey, Ranking Member Scott, and distinguished members of the committee, it's an honor to testify before you today regarding inclusive disaster management. I'm grateful for the opportunity to address this committee and appreciate your continued support of this critical issue that affects older adults and people with disabilities. Let me state at the outset, the way we currently mitigate, prepare for, respond to, and recover from disasters is not inclusive or equitable. In this testimony, I will describe that older adults and people with disabilities remain disproportionately affected by disasters, that disruptions in access to healthcare and necessary supports are a critical need to be addressed in inclusive disaster management, that strategies to promote aging in place throughout the phases of a disaster can better support older adults, and that a whole community approach to disasters is essential. I'm a researcher who studies disasters in health, focusing on how to promote healthy aging in the face of an increasing number of disasters. I'm also a nurse practitioner by training, and I regularly deploy to disasters across the U.S. I witness firsthand the effects of the disasters I study, the challenges of healthy aging during and after a disaster, and the consequences of these events on individuals and communities. Much of my work is focused on supporting individuals with healthcare needs throughout a disaster. In my experience providing healthcare in Puerto Rico after Hurricane Maria, you might think that I treated injuries or provided some kind of emergency care. In actuality, though, the majority of the patients I treated were there for basic primary care and management of chronic health conditions. Diabetes, high blood pressure, and kidney disease, for example, conditions that require and benefit from regular and sustained access to healthcare. When communities are disrupted by a disaster, so are the supports for those that live there and the normal patterns of functioning in those communities. The loss of basic infrastructure, such as electricity or transportation, can cause serious care interruptions, especially access to healthcare, which can have long-lasting health effects, especially for those with chronic conditions. Our team published a study that looked at how this disruption affects long-term health through the lens of cancer care. And we found that people with a cancer diagnosis who lived through Hurricane Katrina died at a significantly higher rate than people with the same characteristics and types of cancer who did not live through a hurricane. Our takeaway was that it was not the hurricane itself, but rather the lack of access to healthcare and normal patterns of healthy living after the disaster that contributed to the greater rate of deaths. Inclusive disaster management should include promoting aging in place throughout the phases of a disaster, with the goal of supporting older adults to stay in their preferred living environment. In our study of home health agencies affected by Hurricane Harvey in Texas, 76% reported a disruption in services, despite that 99% of agencies reported having the required emergency preparedness plans in place. Nearly half of the disruptions of care services lasted 1 week or longer. We've also studied older adults' preparedness through a large national poll. Participants reported feeling confident that they were ready to address a disaster, but also reported low levels of preparedness actions, the actual steps to be ready for a disaster, like having an evacuation plan or putting together a disaster preparedness kit. Critically, among older adults who rely on electrical medical devices, that is, non-battery operated medical devices such as an oxygen concentrator, only 1 in 4 had an alternative power source, such as a generator. I and my colleagues have also learned from home-based care providers who have worked through recent disasters, including Hurricanes Harvey and Irma, and now the COVID-19 pandemic. Some of our findings are that home-based care represents an excellent insertion point to support readiness and to provide older adults with the tools they need to protect their health during an emergency. But we also found that home-based care is frequently not included as part of the healthcare response to disasters, where the focus is on hospitals and nursing homes. Home-based care organizations reported feeling left on their own to care for patients after disasters, where patients would be left on their own if home-based care was not available. Including home-based care organizations as a partner in emergency preparedness planning is essential. Inclusive disaster management must include systems for continuity of care throughout all phases of a disaster. And that starts with strengthening relationships in the whole community among emergency managers, healthcare coalitions, aging organizations, home-based care providers, to name a few, and most importantly, including the voices of older adults and people with disabilities centered as the key stakeholders. Thank you again for the opportunity to participate in today's hearing.
Dr. Bell, thank you for your statement. Before we introduce our next witness, I also want to acknowledge we've been joined by Senator Warnock of the state of Georgia. So next, we'll turn to Dr. Spurlock. Dr. Spurlock, you may begin.
Thank you, Chairman Casey, Ranking Member Scott, and distinguished members of the Senate Special Committee on Aging for affording me the opportunity to speak with you today. My name is Dr. Wanda Spurlock, and I'm a professor of nursing at Southern University A&M College located in Baton Rouge, Louisiana. For over 2 years following Hurricane Katrina, my School of Nursing delivered primary health care services to one of the largest FEMA transitional trailer sites in the state. Based on our unique experiences, I will highlight a few of the important issues that were evident and that impact the well-being of older adults and persons with disabilities when confronted with major disasters. Timely access to medical and support services following a disaster is critical. However, treatment for chronic conditions such as hypertension and diabetes can often be delayed for periods of time, leading, unfortunately, to poor health outcomes. Many older adults had lost their assistive devices and home equipment needed to monitor and treat various medical conditions. In addition to being separated from prior systems of health care, these evacuees were also separated from their social support networks, including family and friends, some of whom had been evacuated to other states. Our work has revealed that most evacuees did not have an emergency plan in place in the event of a disaster, highlighting the need for more targeted work in this area. Detailed information about the School of Nursing's role in delivering healthcare following Katrina can be found in a publication by Spurlock, Brown, and Ramey, Delivering Primary Health Care to Hurricane Evacuees, the Role Schools of Nursing Can Play, published in the American Journal of Nursing. Based on my experiences in the disaster arena, the following key issues are paramount regarding older adults and persons with disabilities and should be addressed in disaster planning, funding, and policy decisions. Because effective and holistic planning is critical to the success of disaster response and recovery, the full inclusion of older adults, disabled persons, and others with access and functional needs is necessary to mitigate the impact of disasters on these vulnerable populations. Access to healthcare and other supportive services is critical following a major disaster, especially when evacuees are forced to relocate to other states, thereby risking the loss of desperately needed long-term care services and supports. Training and resources must be made available to support community-based organizations to ensure equitable access to services and programs to prepare and support vulnerable populations during and after disasters, including integration back into the community. Prioritization and disaster research funding to inform evidence-based actions and policy decisions that support the needs of older adults and persons with disabilities across diverse ethnic and minority groups is warranted. As a nation, we must continue to seek solutions to overcome the unique challenges that older adults and persons with disabilities face when preparing for, responding to, and recovering from disasters. I was pleased to read about several recently introduced legislation that addresses many of the issues that I have presented. The passage of the Real Emergency Access for Aging and Disability Inclusion Ready Act will ensure that the life experiences and voices of persons with disabilities, older adults, and others with access and functional needs are included in the preparation, response, recovery, and mitigation of disasters. This inclusion is paramount to ensuring the best possible outcomes for these vulnerable populations. The Disaster Relief Medicaid Act, DERMA, ensures that Medicaid eligible persons forced to relocate from an area under a presidential disaster declaration to another state will be able to maintain their Medicaid supported services, including home and community-based services. Passage of DERMA will address many of the issues that impacted the health and well-being of evacuees following Hurricane Katrina, and also will impact their health in future disasters. As the nation continues to recover from the COVID-19 pandemic and in preparation for future disasters, the FEMA Empowering Essential Delivery FEED Act allows the government to pay 100% of the costs to states and localities so that they can partner with restaurants and nonprofits to prepare nutritious meals for vulnerable populations desperately in need. In closing, I would like to thank you again for this opportunity to share my thoughts and experiences as a nurse, clinician, educator, and researcher. I once read a quote by Mahatma Gandhi: "The true measure of any society can be found in how it treats its most vulnerable members." Progress has been made in disaster planning, response, and recovery. Although there remains work to be done to ensure the best possible outcomes for older adults, passage of these legislations will present a significant step in solving many of the issues that I have presented. And I commend the Senate Special Committee on Aging for shining a national spotlight on this important issue. Thank you.
Well, Dr. Spurlock, thank you for your testimony. We'll turn next to Mr. Creamer.
Good morning, Chairman Casey and Ranking Member Scott and members of the committee. My name is Randy Creamer. I'm a native and resident of South Carolina. Over the past 35 years, I've served as a volunteer and a professional assisting those affected by natural and man-made disasters. Bringing help and healing and hope to individuals and families and communities has been the most rewarding work of my life. Thank you for the opportunity to share a brief testimony. National VOAD, as already mentioned, is an organization that provides cooperation, communication, coordination, and collaboration, and fosters more effective delivery of services to communities affected by disasters. Founded over 50 years ago, National VOAD is a coalition of 70 of the nation's most reputable national organizations. They're faith-based, community-based, and other nonprofit organizations as members. Our South Carolina VOAD is committed to the 4 C's with a strong focus on communication amongst members engaged in a specific response. Our VOAD in South Carolina is not operational in the sense of telling any organization what they can or cannot do or where they can or cannot serve. We strive to enhance effectiveness in assisting those who are hurting. Many volunteer organizations are involved in the initial response only. Others may not be involved for weeks or even months, but each organization brings its strengths to the table. And few, if any, of those organizations are engaged from the first hours of an event to the complete recovery, which can take several years. The South Carolina Baptist Convention became involved in disaster relief in 1990 following Hurricane Hugo. Today, we have 2,500 volunteers who have attended our training, completed background checks as part of our credentialing process, and prepared to assist others affected by disasters in South Carolina, across the U.S., and occasionally even internationally. We're part of the larger Southern Baptist Disaster Relief Network that encompasses all 50 states. This year, we sent 19 teams to the Hurricane Ida event. Those teams went to both Louisiana and Pennsylvania serving. Our primary task is to provide immediate assistance after various wind events like tornadoes or hurricanes or thunderstorms or flood events that can occur after a tropical system or some heavy rain event. Our volunteers typically sleep in church buildings on cots or blow-up mattresses, and they bring along mobile showers and laundry trailers and volunteer cook teams and all the logistical support that they need. Another major task is to partner with the Salvation Army and the American Red Cross when mass feeding is required to support those who have been evacuated and support those who are unable to prepare meals for themselves. Aside from myself and two coworkers, all South Carolina Baptist Disaster Relief is provided by volunteers, most of whom are retired. Our volunteers are motivated by their personal faith in Jesus Christ and the desire just to love God and love others. They are our most valuable resource. The American Red Cross and the Salvation Army lead the way in providing mass care. United Methodist congregations provide much of the same kind of service as Baptist, and the Presbyterian Disaster Relief and Adventist Community Services Disaster Response are other major partners that lead the way in the long-term recovery. We're blessed with numerous other partners. Over the years, we've learned a number of critical lessons. We've learned that disaster impacts increase substantially on structures and houses that have pre-existing deferred maintenance issues. We've also learned that we can't do everything. You have to find your niche and really do it well. We've learned that we can't help everyone. We have to prioritize and identify the most vulnerable. Our priority is on those who are unable to help themselves. They lack financial resources, have no one else to help them. For example, widows, senior adults, certainly retired folks, our grandparents raising grandchildren, single parents. We also strive to help our body of first responders that are often neglecting their own personal needs and family needs because they're serving the community. And finally, we've learned that we have to allow our volunteers a great deal of leeway in the ways that they respond. Like they discover a lady lost her refrigerator and all of their food, and we're just there to take trees off the roof, but in turn, they buy her refrigerator and restock her pantry. In closing, I'm pleased to say that for 54 years, we've been involved and dependent on retirees for most of our volunteers within the Southern Baptist Network. As one generation ages out, the next one steps up. But today we're excited with the number of college students that join us. We look forward to serving our neighbors in disaster relief for years to come, and we do appreciate the opportunity to share a little bit about our story.
Mr. Creamer, thank you for your statement. We appreciate you being here, and we'll next turn to our fourth and final witness, Ms. Kerner.
Chairman Casey, Ranking Member Scott, and members of the committee, my name is Danielle Kerner, and I will be speaking today as an advocate, former unpaid caregiver, and as a first responder and emergency planner. Thank you for this invitation to share my professional and lived perspectives on this topic. I sit before you as a circumstantial expert. For the past 20 years, I have volunteered and worked in the field of emergency services in Pennsylvania, first as an EMT and paramedic, providing direct patient care and advocacy, then in education and regulatory compliance. In 2012, my husband and I were blessed with the arrival of our first son, Joseph. He was born healthy, but with multiple deformities and congenital amputations in his extremities, requiring surgical intervention, ongoing therapy, and adaptive equipment. In 2015, my 54-year-old mother was diagnosed with early onset Alzheimer's and dementia, and my husband and I became her primary living caregivers while my father continued to travel for work. I became an expert at anticipating needs, adapting everyday situations and tasks to the physical needs of my son, cognitive and behavioral needs of my mother. I had binders of bills tabulated with notes about insurance coverage and payment plans, calendars full of appointments. I gained a new vocabulary and set of skills specific to advocacy for my child and mother, and began to think 10 steps ahead for every task to assure that the needs of my loved ones would be met in everything that we did, both in non-emergency blue sky situations and dark sky emergencies. I built contingency plans for care, kept outgrown medical equipment in case something broke, and kept extra comfort items in strategic areas to soothe fears and calm erratic behaviors. To say that I received a crash course in accessibility and advocacy would be an understatement. I became a survivor before an emergency had occurred. In 2018, my mother lost her fight. I was both devastated and grateful that she had found peace. It was that same year that I was offered the job of Outreach and AFN, or Access and Functional Needs Coordinator, for the Delaware County Department of Emergency Services. I leapt at the opportunity, hoping to integrate my lived experience with professional knowledge of emergency services, both to honor my mother and assure that people like my son were considered before, during, and after disasters and emergencies happened. Very quickly, I learned that my primary function in this new professional role was to be the voice in the room, reminding planners and responders that one size never fits all, that accessibility means more than wheelchair ramps, that not all disabilities are physical, and that all of us will likely have an access need at some point in our lives. I also found myself regularly educating planners and responders that individuals who live every day with disabilities, seniors who have access needs, and individuals who are unpaid caregivers or survivors, a good way to describe them as pre-survivors, even before the emergency has happened. Often they are surviving against the odds, outliving expectations and resources, making do with inadequate services, living situations, or equipment, and recovering from medical, financial, or emotional setbacks because of their personal normal. We as responders, planners, emergency managers, and as policymakers cannot begin to plan for the whole community without first embracing this knowledge. The reality is that if we want to be successful in disaster mitigation, the work must also be done in the fields that operate independent of emergency management, the everyday blue sky supports. We must focus on assuring that circumstances that make individuals pre-survivors are addressed well before the disaster occurs, and stop limiting our conversations on inclusive disaster practices to the disaster itself. Working to enhance accessibility to government services by streamlining technologic and paper platforms used for resources and applications, simplifying processes and terminology, expanding regular operation hours for services, and assuring that resources are known to those who most need it through multi-outlet and media messaging are all just as important as ensuring physical accessibility to buildings. Investing in workforce development and support for direct care and medical professionals, as well as case managers and social workers, is another critical piece of the puzzle. Addressing our nation's housing crisis through the lens of accessibility and bolstering programs designed to increase independent and supported living for individuals who need it most, expanding the criteria for Medicaid and Medicare reimbursement and coverage, assuring financial support to unpaid caregivers, and increasing programs that offer respite services will help. These examples only begin to scratch the surface of this topic. The best way to ensure optimal outcomes for pre-emergency survivors is to ensure that they have unobstructed access to the supports that they require daily, and to include individuals with personal knowledge of these requirements to guide the process. The frequency and intensity of natural disasters are increasing, and the emergency response workforce is decreasing. Paid and volunteer workers are harder than ever to find in my field of work. If we can improve the lives of individuals with disabilities, seniors with access needs, and unpaid caregivers before the emergency happens, we will exponentially increase the resiliency when it does. Thank you for your time today.
Ms. Kerner, thank you for your testimony. I'll start, excuse me, a round of questions with you. And I want to say, with regard to your testimony, as well as our other witnesses, all four witnesses, it's especially heartening when witnesses can bring to a hearing not just professional lived experience, but also personal experience. And that's true of all of our witnesses today. And that's certainly true of you, Ms. Kerner. In your testimony, you said you leaped at the opportunity to work in disaster management to, quote, integrate your lived experience with professional knowledge of emergency services, both to honor your mother and assure that people like your son were considered before, during, and after disasters happen. Unfortunately, not every community is as fortunate as your community is to have an expert with lived experience to serve that community. In your case, to serve in Delaware County in the Emergency Services Department. So for those communities without a person with lived experience at the planning table, national services like technical assistance, like a technical assistance center, can help state and local governments with inclusion. In other words, to do the work that you and others have done locally. So the question I have for you is, how would enhanced representation and technical assistance programs like those included in my legislation, the READY Act, How would that help to save lives during disasters?
Thank you for that question. First, I have to advocate that every community strive to include local stakeholders who have disabilities, caregivers, advocates, and seniors who have access needed at their local process wherever possible, understanding that these individuals may not have a background in emergency management. That being said, having access to individuals who have both personal, lived, and professional experiences through national technical assistance programs will connect these communities with critical information during planning, expert guidance during the response, and then later during the recovery process. While knowing that needs truly are in the community and knowing what those needs are in the community is the first step, having the access and expertise to address them strategically is what will ultimately increase life-saving communications and operations.
I was noting on the second page of your testimony, one paragraph that, at least for me, summarized a lot of your testimony and what we've got to focus on in terms of a list of priority areas for our work. You indicated in the middle of the page, quote, working to enhance accessibility to government services by streamlining technologic and paper platforms. Second, simplifying processes and terminology. Third, expanding regular hours of operation for services. And fourth, assuring that resources are known to those who most need them through multi-outlet and multi-outlet and media messaging that are just as important as assuring physical access to buildings. So that's a good summary of what we would hope every community would be able to avail itself of. So, Ms. Kerner, thank you for your testimony. I'll move to my second question to Dr. Bell. In your testimony, you talked about the research you had done on the health effects of disasters on people with chronic conditions, which is more than 80% of seniors. You found that survival rates were lower for people exposed to Hurricane Katrina than for those who did not experience a storm, likely due to a disruption in access to health care. You noted, quote, the loss of basic infrastructure can cause serious care interruptions, especially access to health care, which has long-lasting effects for those with chronic conditions, unquote, quoting again from your testimony. So going without health care is, of course, for all of us, unacceptable. I introduced a particular piece of legislation called the Disaster Relief Medicaid Act to ensure that people affected by disasters can keep their Medicaid coverage. People are uprooted and they move, and we want to make sure they can still access Medicaid if they've had to move. Can you discuss how policy solutions like this act would help people access their medical care and indeed even save lives following a disaster?
Thank you for that question, Senator Casey. I think one important thing to consider is that disasters do not respect state lines, and neither do healthcare needs. So thinking about how to access thinking about how people can access healthcare needs who have Medicaid, the ability to access their healthcare needs in a different state where they may have evacuated to is crucial. We have to think about ways to meet healthcare needs, and this is a solution that feels or seems fairly straightforward if we can eliminate unnecessary delays and red tape that have characterized past disasters.
Well, Dr. Bell, thanks very much for that answer and also for your testimony. I was noting in your testimony at one point something that and I hope I can get back to this later, but it really kind of jumped off the page. This is on page 3. You start the paragraph by talking about older adults, people with disabilities are disproportionately affected by disasters. The next sentence is, disasters are not natural. That's for a lot of people counterintuitive. You explain by talking about hazards such as hurricanes, wildfires, and tornadoes are weather events that occur as natural processes, but that we know that the impact of climate change, the impacts of climate change advance is driving this. And then you say, and I'm quoting, the impact of these events have on communities is largely human-made and influenced by social, economic, geographic, and political processes. I'll get back to you, I hope, a little later about that, to have you walk through that, but that was an interesting formulation for me to read and to give me a better perspective on what we're up against. I'll turn next to Dr. Spurlock. You have a unique perspective in that you research disaster management, and you live in southeastern Louisiana, which has seen, to say that you've experienced severe weather events, extreme hurricanes over the past 2 decades, of course, is an understatement. Not many regions of the country have had as much in the way of disasters and challenges as the state of Louisiana and that section of the state. In your written testimony, you noted that, quote, populations are not equally impacted by a disaster, unquote. How would equitable representation through the programs that we outline in the Ready for Disasters Act, how would that equitable representation create life-saving approaches during disasters?
Yes, thank you, Chairman Casey. So we know from research, and it's widely accepted, that certain populations will experience a disproportionate burden to disasters, and those populations mainly include older adults and persons with disabilities of all ages. So we know in terms of some of the changes that occur with aging, in terms of impaired sensory functioning, impaired vision, hearing, especially impaired mobility, and also changes in cognition, in addition to a host of chronic medical problems that will occur, will necessitate ongoing treatment with medications and sometimes life-saving equipment, can put those populations at a disadvantage when it comes to response to hurricanes, any type of disaster, and in the recovery phase as well. So I was just really so pleased to learn about your piece of legislation, because it really brings these important persons, vulnerable populations to the table to actively participate in disaster planning, preparedness, because we know in terms of the efficacy of the recovery and the response phases will largely depend on the plans that have been put in place to be able to mitigate some of the negative impacts and outcomes that can occur with these populations. And not only to bring them to the table, but to also to include more diverse representation, knowing that older adults and persons with disabilities is that their life experiences and needs can widely vary. So that's really a significant step in solutions to improve our disaster response.
Well, thanks for making the point about not only representation, but equitable representation, and highlighting some of the legislative approaches and even solutions we can bring to bear. I'm going to jump back to Dr. Bell to highlight another segment of your testimony. In your testimony, you indicated that, quote, inclusive disaster management should include promoting aging in place throughout the phases of a disaster, with the goal of supporting older adults to stay in their preferred living environment, unquote. You also noted that in your study of over 2,000 older adult respondents, that although the majority felt confident in their ability to address a disaster, they actually have taken low levels of preparedness actions, like having a disaster plan and kit. This highlights, of course, the need for support in turning intention into action. Your research has also shown that home-based care providers are an excellent starting point for disaster management. Can you discuss how investing in home and community-based service will improve the ability of older adults and people living with disabilities to remain healthy and safe leading up to, during, and after disasters?
Thank you for that question. We know already that people want to stay in their preferred living environment, and having home and community-based services are the kind of supports that can help them stay in these settings. Home-based care and community support services are investing in these is a good idea in general. We all already know that the population of older adults is increasing, and home-based care needs and the home-based care industry will have to increase as well to be able to meet these needs. So investments in this area in general are an important need. But during a disaster, if staying at home is the safest option, then let's give providers and older adults and people with disabilities the tools to be able to stay at home and live through a disaster safely in their preferred living environment. And we can start by investing in home-based care and community supports, disaster preparedness, and response capabilities. Another thing that we can do is to encourage that whole community approach that we've already talked about, where home-based care organizations, community supports, emergency managers, and the stakeholders themselves, older adults and people with disabilities, can better interact together around inclusive disaster management.
Well, thanks very much for that and highlighting the kind of setting we're talking about, that if you're in a home-based setting, that allows for the caregiver to be obviously more present and potentially more able to do the kind of planning with that older adult or that person with a disability. Just a brief follow-up, Dr. Bell, and one thing we're trying to do now is to allocate time for senators as they come back from other hearings in the next 10 minutes or so. So I'll be asking a few additional questions. But as a follow-up, one of the central elements of the Build Back Better legislation will be an investment in home and community-based services. It's predicated on a piece of legislation I introduced, the Better Care, Better Jobs Act, with which I know you're familiar. But Doctor, in regard to that legislation, I wanted to ask, how much would the policy that is embedded in the Better Care, Better Jobs Act, how would that support both home care workers and family caregivers to improve the prospects for dealing with disaster management for those that the individual worker is serving, in this case, a person with a disability or an older adult?
Well, I think what it comes down to is we need the kind of investments that can better support this industry, the home-based care industry. And by home-based care, I think it's important to define that this includes an array of healthcare that's provided in the home. And so that could be skilled nursing services, physical therapy, other types of rehabilitation therapy, and also home care, which is support and assistance with activities of daily living that are necessary to allow for individuals to continue living in their home. So advancing policy that can better support these industries and these providers themselves to provide the kind of care that can support individuals and communities is really critical. I think it's very important that we start thinking as a mitigation measure, if we're thinking about inclusive disaster management, that healthcare occurring at the home is a new normal going forward, and we need to make investments that support that.
Well, Doctor, thanks very much. I want to turn next to Mr. Creamer. I was particularly impressed by the scale of the volunteer efforts that you made reference to in your testimony, and the number of communities you and so many others have served. It's remarkable, and I was noted as well that you made reference to a number of your teams going throughout the country, including to Pennsylvania. As a senator from Pennsylvania, as a citizen, I appreciate the help that was provided in those terrible circumstances that communities that we faced. And a lot of the communities this summer and fall were communities in the southeastern part of the state where Ms. Kerner is doing her work. So it's entirely possible that they were crossing paths with folks that she was working with. But my question for you, Mr. Creamer, is you provided a fulsome description of how the volunteer workforce can address many of the immediate needs of people who experience a disaster. The work that the South Carolina VOAD does is critically important. Can you tell us how the volunteer workforce coordinates with community needs and more formal supports, such as Ms. Kerner's emergency management program?
Yes, sir. Thank you for the question. When we go into communities like Horsham, Pennsylvania, where we were north of Philadelphia
Right.
just a few weeks ago, we seek to connect with the officials in those counties and those communities immediately. We will go to a fire chief, a police chief, emergency manager for a county or parish. Sometimes it's pastors in local communities, and they can steer us in the right direction. Where the most vulnerable populations are concentrated that need the most help, here are the things that we can offer, and then you direct us to where we can be most effective to help and assist you in your time of need. So we're looking very much at the local officials there to give us that guidance and direction. That is our point of connection.
Well, it's noteworthy in your testimony about the challenges that volunteers face, sleeping in church buildings on cots and blow-up mattresses. That could be challenging for someone at any age, and we're grateful for the work that they do and that you and others have made apparent today in your testimony. I'll now turn again to an additional question as we wait for one or two senators who are on their way. Ms. Kerner, I'll turn back to you now that we've made reference to, as Mr. Creamer did, southeastern Pennsylvania. Appreciate the work that you've done in our state and in a big county like Delaware County. It's, for those of you who don't know it, it's a suburban Philadelphia county. It's, gosh, I think about our fourth or fifth largest county in the state after Philadelphia, Allegheny, Montgomery, and Bucks. So Delaware County, I know, is well more than 500,000 people. So there's a lot of challenges when a disaster hits in a high population suburban community. Ms. Kerner, you talked in particular about your personal circumstances being, quote, a quote, crash course in accessibility and advocacy, unquote, and preparing to be, quote, a survivor before an emergency, unquote. So that kind of crash course isn't only good preparation for you and your family, it's of course of great value to the people of Delaware County and our state generally. The Ready for Disasters Act and the recently implemented Pandemic All Hazards Preparedness and Advancing Innovation Act, another long name which we use the acronym PAPA, and then that word innovation was added when we reauthorized the legislation, the preparedness legislation, which has been was first acted on way back in 2006 and has been reauthorized several times since then. But in both of those bills, part of the focus of both of those bills is the creation of the creation of advisory councils with a high level of aging and disability representation to inform disaster management planning. So if you're going to have a strategy in place at a national or state or regional level, and you make it a priority to address the impact of a disaster on an older American or a person with a disability, you've got to have representation, as Dr. Spurlock made reference to earlier, representation on those advisory councils. The good news is we have advisory councils. The bad news is they need to be put into action. It's been far too slow. We'll get to that later. But the question I have for you, Ms. Kerner, is how have your experience as a family caregiver shaped your approach to disaster management at a very local level?
Well, again, thank you for the question. I learned very quickly from my mother and from my son that needs should never be assumed but always anticipated. Assuming needs was a really good way to offend my mother, who was, prior to her diagnosis, probably the most capable woman I had ever known. So instead, anticipating her needs and taking her lead was a much better approach. Now, as the mother of a budding preteen who happens to have physical differences, the same applies. He has far more to teach me when it comes to what he needs than I have to teach him. So working with and seeking out input from individuals who have access and function needs is the only way to learn what the needs of our community really are, and how best to anticipate areas where assistance may be needed during and after the disaster or emergency has occurred, as well as gain invaluable insight as to how we can work to overcome challenges by taking their lead. So really striving to make sure that we are coming into the situation knowing that we are there to take their lead and we are there to serve them, I think is the best way to approach this situation. That's what I've tried to bring into my work.
Well, it has to help enormously to have personal experience in addition to professional lived experience. That combination, I can only imagine. I've never done this kind of work myself, but I can only imagine the positive impact it must have on someone who's challenged by or even overwhelmed by a disaster, to be able to talk to someone who can relate to them on a very personal level, being able to say, I have some experience with this kind of circumstance, or my in your case, your mom and your son, and other family experiences that you can relate to them, as opposed to someone without that experience who might have the expertise but may not have the personal experience and the understanding that you can bring to bear when you encounter someone who's really in jeopardy and not knowing what the next hour or the next day will bring when they're overwhelmed by a disaster. I'm often told the story about my own experience as a legislator, having some sense of what people undergo when they experience a natural disaster, but not really fully understanding it, at least in my own case, until 2011. We had terrible, devastating flooding in several parts of our state. I live in northeastern Pennsylvania, and I remember visiting rural communities in northeastern Pennsylvania and seeing the devastation, but also just seeing how violated individuals felt in a very deeply personal way. And I told the story often about a friend of mine who was a lawyer in a neighboring county, and he was the most confident, upbeat, even cocky person you'd ever want to meet, never down, always upbeat, always ready to tackle any problem, full of self-confidence. And when I said hello to him at a stop at a disaster site where there's terrible flooding, a lot of families had their homes either flooded out completely or badly damaged. His was one of the homes. I remember walking up to him, putting my hand out to shake his hand, thinking that he'd say, I had some flooding, but I'm good. As soon as I shook his hand and looked in his eye, he started to cry. And I never thought I'd ever see this very strong, confident person be so devastated. And so it gave me an insight I didn't have before. And I can only imagine, Ms. Kerner, the number of times you've been able to draw upon your own experience. Dr. Bell, I'll jump back to you for an additional question. We know that this kind of preparedness, emergency preparedness, is a top concern of several government agencies, and the federal government, the Department of Health and Human Services Inspector General just released an annual report. I won't make detailed reference to it, but just holding it up. This is a Health and Human Services Inspector General report, which is a report of management challenges for the department. This is just released earlier this week. It comes after our nation has spent 2 years living with a pandemic that, as I made reference to earlier, that terrible number that keeps going up of 760,000 lives lost in the grip of the pandemic. COVID-19 has been a lesson in preparedness shortfalls, reinforcing why the department's independent watchdog says that HHS must do much more to prepare for these emergencies. So, Dr. Bell, the Obama administration updated emergency preparedness rules for both Medicare and Medicaid providers for the first time in a quarter century. These were implemented in 2017. In light of the pandemic and the Inspector General's concerns, as expressed very recently, are Medicare's emergency preparedness rules sufficient to address the needs of people with disabilities and older adults in nursing homes and other congregate settings during disasters?
Thank you for that question. You mentioned the COVID-19 pandemic, and over the course of the past 18 months of the pandemic, I've had the opportunity to visit a number of nursing homes where I provided training in personal protective equipment use and conducted voluntary infection control assessments in order to support staff, their own safety and the safety of the residents of those homes. So definitely an area that is near and dear to me. You mentioned the CMS emergency preparedness rule, which I believe was introduced in 2016 and put into effect in 2017. The goal of the emergency preparedness rule was to implement national standards for healthcare organizations that are receiving Medicare and Medicaid funding. And this was introduced, I believe, largely to avoid the kind of tragedies that have been seen in nursing homes and other healthcare settings prior to 2017. But unfortunately, we're still seeing many of those challenges and lack of preparedness even after the implementation of the rule. I think a couple things about the Inspector General's report and the emergency preparedness rule itself. One is that the rule was implemented now between 4 and 5 years ago, and we don't have a substantial amount of evidence to understand if the rule is working in the way that it should be working. And I think it's important to note that the intention of the rule is an important and a good one. Facilities should have emergency preparedness plans, and they should be preparing their employees using a set of standards. So that's an important one. But the rule was implemented with a fair bit of leeway allowing healthcare organizations to determine the type of training and drilling and plans that they wanted to do. So I think that there's a balance between allowing this leeway and being overly prescriptive. That really matters for low-performing settings that don't have good training, drilling, and plans in place. But it may unnecessarily penalize, or not, maybe penalize isn't the right word. It may be unnecessarily prescriptive for organizations that do put a fair bit of emphasis on being prepared. I think what my recommendation or solution is to provide better opportunities for tailoring of emergency preparedness planning for organizations, for thinking about older adults and people with disabilities. How can we better tailor emergency preparedness plans to the organizations that are providing care for those individuals? And how can we do a better job of supporting organizations in their emergency preparedness planning without providing new or without taking away some of that leeway that has been successful?
Doctor, thanks very much. I'll turn next to Ranking Member Scott.
Thank you, Mr. Chairman. Let me ask a question of Mr. Creamer as it relates to heirs property and the importance of the changes that have been made based on the request that we submitted, Senator Ossoff and I. When recovering from disasters, how big a problem was the lack of a title to heirs property for rural majority minority counties in South Carolina?
Thank you. Thank you for the question, Senator Scott. In our role, going in the early hours, the first few days of doing what we do, helping that initial recovery and mitigating continued damage, that was not that big of an issue. The issue really becomes huge when we start the rebuilding long-term recovery process, or if that resident is trying to access different sources of financial assistance, be that particularly the FEMA assistance for damage to a homeowner. That proof of title is almost a deal breaker. In those instances, it doesn't stop us from doing what we do, but when it moves into long-term recovery, it is a huge obstacle. And the work that the organization we have down in the Charleston area that's helping with that has been huge to help those families that have owned property for upward, well over 100 years, but there's no proof of title, and they don't have the resources to go do a title search many times.
I see. So in other words, the work that you do, which is excellent work, by the way, thank you for doing it, is not impeded by the heirs property challenges that we see across the country and specifically throughout the South. But when it comes to receiving the resources from FEMA, the heirs property, the lack of a clear title, I should be clear that I'm so used to saying heirs property as if everybody listening to us knows what heirs property really is. In fact, they may not. As land is passed down within families, you have so many heirs, sometimes no individual person within that family has clear title. Therefore, heirs property is property really held in common in many ways, and that common property being held in common does not give any specific person the right to advocate on behalf of that property. And so that also stops that family of individuals from being able to receive assistance from FEMA. Is that what I heard you say, sir?
FEMA and other sources of assistance. It can be from faith-based organizations. Everybody wants proof of property ownership.
Yes, sir. Thank you very much. Professor Spurlock and Ms. Sue Ann Bell, do you agree that we need more flexible funding to support local restaurants cooking fresh, healthy meals during disasters? In other words, the FEED Act that we have spent a lot of time working on, that both the chairman and I are now co-sponsors of, would it not be helpful to have more flexible funding support for local folks who understand and appreciate the severity of the challenges faced by those communities where the disasters happened within?
Yes, and thank you for that question and statement. And being a resident of Louisiana, and of course having experienced numerous disasters, namely hurricanes and floods, I can really see the firsthand importance of having those types of resources available. because oftentimes following disasters, and even more recently here in Louisiana, following Hurricane Ida, and in my specific community, we experienced power outages. I did personally for 5 days or so. And so what that meant was that many individual homes had really lost all of their perishable goods. They all had to be thrown out of the refrigerator and the freezer. And we also, recognize even with persons with disabilities, a large percentage actually reside in, southern states. And these southern states also border the, Gulf of Mexico. And so we're all prone to these types of disasters. And then also poor communities, oftentimes, and older adults live in, areas that are considered food deserts, so to speak.
Yes,
And
ma'am.
so yeah, so just having the availability of resources on the ground to be able to offer a warm, nutritious meal, perhaps, served, with a smile in a person's, local community, so they aren't faced with additional hardships and challenges of having to, seek transportation to drive miles to find perhaps a restaurant that's open, only to find that the line is several miles long, and so you still leave hungry, not really having the nutrition that you need, and definitely not access to nutritious meals. So that is a really win-win, I think, for all parties involved.
Thank you, ma'am. If you're waiting along that line that long, Mr. Chairman, you're going to be hungry and frustrated.
Yeah.
So that's a fact. Thank you, ma'am.
Ranking Member Scott, thank you very much. We'll turn next to Senator Braun.
Thank you, Mr. Chair. When it comes to something this important, to where it's random in its occurrence, we know that it's inevitable over time. I think we ought to do something that puts better processes into place. It would mean that you got to make sure that when you do have to be quick and be responsive, that you've got the funding in place, number one, and then also guidelines where you're not wasting any time before you can actually get to the issue at hand, because so often it seems like we are ill prepared in terms of the immediacy of it, in terms of whatever structure and processes that should be in place to where there's no fumbling around. The bigger issue is probably how we pay for it in the long run. And for things of this significance, most places would have a designated rainy day fund to where it would be funded separately, where it'd be ready to go. And ideally, it would be in the context as we become more fiscally responsible over time, borrowing money to pay for our operating budget currently to the tune of about 25%. That's soon to go up even to a higher percentage. I think there really needs to be some reform on general fiscal issues here. I'd like to direct my question here to Mr. Creamer. Tell me what you think the current status is on the guidelines, the processes, the things that are needing to be in place to where you know what to do when the tragedy, the event occurs. And then what are your thoughts on establishing a rainy day fund? I've got legislation that would like to do that to where we're not then on an ad hoc basis having to put funds into play, to where we have better, ready to go functions and processes, number one. And then number two, a rainy day fund that would support it, where we're not scrambling around in terms of how to fund something in the immediacy of the incident. Mr. Creamer.
Thank you, sir. Great question. Yes, I agree wholeheartedly. It's second question, the part dealing with funding, to have a rainy day fund in your back pocket, so to speak, that you can draw from, would be a huge asset, because funding does become such an issue for everything that we're doing. Even in our world of volunteers, we can't do what we can't fund. So having that as a backup, it's certainly warranted as such. Looking at the ways that we can be prepared and how we do it is just positioning both the professional, if you will, response, as well as utilizing some of the volunteer respond groups across the country is a huge asset, and just both working together, having those communicate closely. Our VOADs enable us to do that through our states as well as the national level. So that's the best way we have, is to have those relationships, to know each other, and to work and be ready prior to any kind of event, any kind of challenge that we experience.
Well, thank you. And as a closing comment in general, for anyone watching out there, we currently have a federal budget that runs around 4.5 trillion. And we currently raise revenues to the tune of 3.5 trillion. So that is a structural $1 trillion deficit that we've come to accept and kind of shrug off as not being important. And that doesn't work in any other place. All state governments live within a framework to where they generally have cash reserves and rainy day funds set up. So it also brings to light that in the amount of money that we're currently wanting to spend, and it remains to be seen how much of that will be borrowed versus paid for, I think certainly it's clear that the financial stress on the country and for all the places that look to the federal government, including the Medicare Trust Fund, which is about ready to go kaput here in 4.5, 5 years due to high healthcare costs and putting too many benefits in there, and our elderly depend on it for their health care. Social Security, it has got about another 10 or 11 years. We've been paying into that since the FDR days. So I think this idea of taking care of natural disasters and doing it in a responsible way also begs the question, when are we going to get our financial house in order here in D.C. generally? Thank you.
Thank you, Senator Brunn. I'll turn now to Ranking Member Scott.
Thank you, Mr. Chairman. This is a question for all the panelists. Working with local emergency management is such a critical component of disaster relief and frankly, the response or the coordination. In a earlier life, Mr. Chairman, I was the chairman of the Emergency Operations Center for Charleston County during hurricanes and natural disasters. And so I spent a number of 24 to 36-hour days in a command center where we had an opportunity to try to coordinate the response team's efforts on behalf of communities before, of course, the hurricanes or natural disasters happened. We would have meetings every year praying and hoping that we didn't have to mobilize the team, but realizing that it's always an if, not a win. Or a win, not an if. And so one of the things that I realized during that time was the importance of having everybody on the same page, whether that was voluntary efforts, the law enforcement, the EMS, the fire, the councils themselves, and then we, in Charleston County, had 17 different municipalities. So we had to have all 17 heads of government working with the county, plus the volunteer apparatus, and all the fire departments, all the law enforcement agencies, and all the nonprofits that we wanted to be a part of that process. So the importance of that local coordination can't be usurped or replaced by a federal top-down approach to natural disasters. My question for the panel is, what are the best practices voluntary organizations and local emergency managers should follow to ensure volunteers are included, and I want to emphasize included, in all phases of disaster management? And that really, from my perspective, means from the beginning, and the beginning isn't the day before the disaster, it's all year long, as we all know that we're going to have to face them in the future. So what are the best practices that we should embrace and be aware of?
Yes, thank you. This is Dr. Spurlock. And I think that's an excellent point that you make, because really the planning has to be ongoing. We know that hurricane season ends, fortunately, in 2 days on
Yes,
November
ma'am.
20th. Yes, but I'll work in terms of increasing our, preparedness and ability to be able to respond to these unforeseen disasters is ongoing. And as you mentioned, is really, I think it's a community, based support, because when disasters ensue, it's going to be at the level of the local and the communities that are going to need to initially respond, to meet the needs of their populations. And I think that's also when it's really critical to have overall knowledge of the overall health of the various communities, because that has to be taken into consideration, because it will determine more or less the scope of services that will have to be deployed, and also in terms of the disaster response as well. So we know that many of our communities throughout our nation exist today in poor health status. And all of those statistics are readily available to us through the America's healthcare rankings. And so we know in terms of the various, social determinants of health and how they can drive more or less a community's ability to be able to respond to a disaster. So all those have to be taken into careful consideration. And by bringing all the individual organizations to allow them to become stakeholders, to have a voice, and then not to overlook sometimes organizations that can really play a critical role at the community level, namely faith-based organizations. I witnessed this firsthand following Hurricane Katrina, how those faith-based organizations immediately stepped up to the plate and started to open what we sometimes refer to as pop-up type of shelters, but that gave tremendous support, to the community at large, and sometimes also overlooking the resources that academic settings can bring, to the table as well, because they are, embedded in the community. Persons who are employed in those, organizations have a really good, mindset and viewpoint in terms of the overall needs of the communities. And once we can pool all of those resources together, as we were able to do as a School of Nursing following Hurricane Katrina, to get involved in that healthcare for extended periods of time, but we realized that no one institution could go at it alone. It's really the whole of the community, academic settings, public and private partnerships, that is incumbent upon us to garner our resources and to step up when disasters do hit our communities, and also to have an ongoing plan and dialogue.
Thank you.
Thank you.
Senator Scott, thank you very much. We'll turn now to Senator Gillibrand.
Thank you, Mr. Chairman. Dr. Spurlock, thinking about the dedicated staff who care for older adults in nursing homes, what's the most critical piece or lever that we can use to ensure that they're prepared for the next disaster? And what is the best way we can ensure that the needs of older adults and people living with disabilities are known and anticipated in a disaster?
Thank you, and I'm really so pleased to be able to participate in this hearing today, because it really shines a national spotlight on this issue. And of course, nursing homes might oftentimes lack, some of the resources that are in place that private institutions, other larger healthcare industries, acute care hospitals may have, access to. So I think it's an ongoing need for funding in terms of resources for ongoing education, in terms of disaster, preparedness, in terms of even to be able to make, decisions in terms of evacuation, based, compared to sheltering in place. And so all of those are just critical, decisions that must be made, in long-term care settings. But I think mainly in terms of resources to support the staff, to give them the necessary resources, education, preparedness, even as we saw with the COVID-19 pandemic, just to have the resources in terms of, personal, protective equipment available to them to be able to use on a day-to-day basis.
Thank you. In the current and escalating climate crisis, we will continue to see and experience extreme weather events. Climate change, together with other natural and human-made health stressors, influence our health and well-being in numerous ways. From the pandemic, that our experiences can be vastly different within the same state, city, and even same house, depending on a person's age and their physical and mental health. So we need to do better to support and anticipate how disasters can affect different groups of Americans and marginalized Americans. And we can do better by including people with diverse capabilities and experiences in planning discussions. So I'm proud to support Senator Casey's Real Emergency Access for Aging and Disability Inclusion for Disasters Act, or the READY Act, which would really work towards ensuring that older adults and people with disabilities are involved in the preparation and response and recovery and mitigation of disasters. So, Dr. Sue-Ann Bell, how would a National Commission on Disability Rights and Disasters help ensure the gaps in inclusive disaster planning, response, and recovery are closed?
Thank you so much for that question. I think the National Commission, which by my understanding will have a large makeup of people with disabilities, will center the needs of the disability community and the aging community. I think the commission itself is made up of, or the mandate of the commission is to draw from a diverse group of stakeholders, which is really, when we talk about a whole community, what we really do need is to understand. I understand there's a local coastal emergency manager that, for example, that will be on the committee versus a area from a non-coastal region. There's disability advocates and representatives that are making up the commission. So I think that it's the goals of the commission are important and needed, and will advance inclusive disaster management.
Thank you. Ms. Kerner, thank you for sharing your professional and lived experience on the importance of including people with diverse capabilities in the disaster planning process. What are the significant gaps in inclusive disaster planning, response, and recovery that you noticed through your experience? What resources did you find most helpful?
So thank you so much for that question. Here in southeastern Pennsylvania, I'm part of a really fantastic team of individuals made up of multiple backgrounds and diverse capabilities, areas of expertise, called the Southeast Regional Task Force Access and Functional Needs Subcommittee. During the pandemic response, during the response post-Ida, and even back with ESIS, one of the things that we did was turn to this group of individuals to determine where the gaps were, and make sure that nothing was being left out, and really looking to that group of individuals to make sure that when we were forming our response and forming our the ways that we were framing things, it was really through a whole community lens. So I think one of the things that we noticed early on was need to improve communication. So we worked with a lot of our community partners to make sure that everything was accessible from multiple language perspectives, from written and non-verbal communication perspective, and making sure that we were getting the message out through multiple different sources. So that was something that we saw early on, and we're able to respond to specifically because we had individuals with that background, with that personal experience, and with that area of expertise. So I really think that the value that individuals from all different backgrounds that they bring to the community and bring to this topic really cannot be devalued at all.
Mr. Chairman.
Thanks very much, Senator Gillibrand. Here, we have three senators awaiting questions: Senator Rosen, Senator Blumenthal, Senator Kelly. Senator Rosen.
Thank you, Chairman Casey, Ranking Member Scott. It's a really important hearing, and I appreciate everyone who is here, all the witnesses today. I want to talk a little bit about something happening in my state and across the West is extreme heat and wildfires. Because around the world, and of course here in the United States, climate change has worsened, and the devastating impacts of wildfires and extreme heat, particularly in Western states like mine, Nevada, it's just been devastating. Already this year, we've seen over 49,000 wildfires burn over 6.5 million acres of land, including several recently affecting Nevada, like the Tamarack and Calder fires. They forced residents in parts of Douglas County to evacuate their homes amid a declared state of emergency. Worsening wildfires, they not only pose a serious threat to human life, to our health, to personal property, to wildlife, And of course, our seniors, some of the most vulnerable. That's why I recently introduced the Fire Information and Reaction Act. It's bipartisan legislation that directs NOAA to establish a new program to improve wildfire forecasting and detection, because more accurate predictions and warnings, they really can protect lives and livelihoods, not just of Nevadans, but for everyone. And so Dr. Bell, as someone who's been deployed to provide clinical nursing care in response to Western wildfires, what can you tell us about what you've seen about the frequency and severity of the fires as they're impacting our most vulnerable, of course, seniors, rural Americans, people of color?
Thank you for that question. I have had the opportunity to deploy to Western wildfires and was at the Paradise, California wildfires, working in a shelter to provide primary care and emergency care. And one important thing to think about is that these wildfires displace broad swaths of populations from their homes and from their communities. And I know I've talked a lot about the importance of aging in place and the importance of staying, in the preferred living environment. And that's not possible when evacuations are in order after wildfires. So we really have to be thinking about, for older adults and people with disabilities, how can we better improve our planning around short notice and no notice evacuation and sheltering needs, as these needs, we can expect them to increase in the future.
Thank you. I appreciate that. I look forward to working with you on that for sure, to be sure we have the right places to put people in emergency and beyond. I want to move on to speaking of emergencies and during disasters, mobile clinics. We know how mobile clinics, and of course during COVID, what a difference they've made. So Dr. Spurlock, your testimony, you discussed how in the aftermath of Hurricane Katrina, Southern University and local FQHCs, they made use of these mobile health units to deliver regularly scheduled care to displaced residents, emergency care, and the like. Mobile units have been doing this for COVID-19, of course, across the country and in my state of Nevada throughout the pandemic. And Susan Collins and I have bipartisan legislation to provide communities greater access and flexibility to use federal funds to deploy mobile health units, particularly in rural areas and underserved areas like Nevada and Maine that we have a lot of. So, Dr. Spurlock, can you tell us more about the vital role mobile health units can play in serving seniors, of course, during a disaster, but we know they serve other times, but how can we use these mobile health clinics that play that important role to deliver health care?
Yes, and thank you for that question. And little did we know when our School of Nursing acquired our mobile unit that we would deploy it in actual hurricane response efforts. Prior to that, we were already within the community trying to reach vulnerable populations who otherwise would not have accessibility to healthcare services. So we had already outreach to rural areas, to seniors, to homeless populations, to battered women's shelters, and we had a healthcare infrastructure already in place that would allow us to be able to have a rapid response to meet the needs of the hurricane evacuees. And so mobile units are really irreplaceable because the mobile units, of course, are clinics on wheels. So when a clinic is on wheels, you can actually deploy it to diverse settings and actually go to where the healthcare needs are. And those mobile units, when they are staffed with healthcare providers, in our instance, we used family nurse practitioners and advanced practice nursing model in collaboration with a family practice physician, and also called upon our many years of partnerships with other healthcare agencies and organizations throughout the community, many of whom served the needs of older adults and persons with disabilities, and as you mentioned, the federally qualified healthcare centers. So we could bring all of those services to what I would refer to as a one-stop shopping, so to speak. So they were all deployed into, central areas to where their hurricane evacuees would have immediate access to our services. And then also to promote continuity of care to, reduce the likelihood of fragmentation, and that those, hurricane survivors could also receive their services and follow-up care at the same site. Thank you.
Well, thank you. I really think that mobile healthcare, telehealth, whether it's an emergency or not, they really expand access and improve and save lives. So thank you. My time is over. Thank you, Mr. Chair.
Senator Rosen, thanks very much. We'll now turn to Senator Blumenthal.
Thank you very much, Mr. Chairman. I want to thank all our witnesses for their testimony today, very helpful and informative. In Connecticut, we have 845,000 adults over the age of 60, and we have serious storms like every other state in the country, often causing flooding, transportation failures, roads devastated. We often have these superstorms, which are becoming the new normal, that can be devastating for seniors, causing them to evacuate, and then even more depressing when they try to return to their homes because there's serious property damage, everything from downed trees to holes in roofs and the litany of problems that can be caused to homes. I am grateful to Senator Casey for the Disaster Relief Medicaid Act, which I've co-sponsored, that ensures that individuals eligible for Medicaid who are forced to relocate during a disaster are able to continue access to Medicaid-supported services. We focus a lot on the service aspect of disaster relief, but I want to ask our witnesses about the property aspects, and most particularly access to property insurance, the money that's needed to repair the roofs and the windows and remove the trees and make homes, again, livable. I have found many of our elderly have trouble accessing insurance, more trouble than others, because number one, they may not keep records that are necessary for accessing insurance. Number two, they can be confused by the litany of criteria and technical requirements. And number three, they may not have the access to communication, whether it's internet or cell phones, especially if cell phone service is down, that others may, because they can do it from work. So let me ask all of our witnesses whether you think that property insurers and insurance needs to be made more accessible, more easily available to seniors in the wake of these natural disasters.
I'll take that one. I think that's a great question that comes with a lot of complexity. Of course, we want our most vulnerable of our citizens to have the resources they need to live through a disaster and to return to their homes and be safe. We also have a lot of complexity involved in how we can support individuals through federal funding to access federal funding to recover from disasters. So I think that's a key point to think about, is how can we reduce some of the complexity around access to insurance, and also accessing the benefits that insurance payments provide. But I also think that, that's a fairly complex question to even tackle, and one that needs, probably its own hearing, if I do say, when we think about the National Flood Insurance Program and the challenges that individuals have in living in, communities affected by climate change and in accessing insurance in the future.
it may be worth its own hearing, but I really think it's a vital part of this picture because the seniors or elderly trying to go back to where they live, and often they've lived there for a very long time, and they have emotional connections, often find it very difficult to deal with insurance companies, and trying to aid them, as my office often does, is also made more difficult because they may not have prepared for this kind of disaster as long as they may have lived in their homes. And they deserve relief from the property insurers. They need and deserve the reimbursement for making their homes livable again. But often the insurance companies fail to provide the kind of aid that they should. So I welcome your interest, and I hope the other witnesses are interested as well. And thank you, Mr. Chairman.
Thank you, Senator Blumenthal. I want to thank everyone who made this hearing possible today. I want to start with Ranking Member Scott and his team, as well as my staff and so many others who made it possible. On top of that list are the witnesses who appeared today, Dr. Bell, Dr. Spurlock, Mr. Creamer, and Ms. Kerner, for their testimony and for both the personal experiences they bring to bear on these issues as well as their professional experience. And we're grateful they're with us today. As we've heard today, natural disasters are increasing in both frequency and severity. The COVID-19 pandemic has shown us that we need to prepare for the compounding effects of both disasters and public health emergencies. People with disabilities and older adults are disproportionately at risk for negative health outcomes and death due to these disasters. We know that. We've got to do something about that. And these disparities must be remedied. I think we've made some progress today in recommending some of those remedies. We need to prioritize the voices of seniors and people with disabilities, especially from communities that are too often left behind. The Ready for Disasters Act legislation I've introduced will mandate that people with disabilities and older adults will be included in all phases of disaster management and provide resources for communities to plan more inclusively. That's what that bill will do. Our witnesses' research that they've summarized today shows that the majority of seniors and people with disabilities prefer to live in their own homes and their own communities. And emergency planning should reflect that preference. I want to turn just to finally to the mechanics of our hearing, in addition to reiterating our thanks to all the witnesses for contributing both their time and their expertise. If any senators have additional questions for the witnesses or statements to be added, the hearing record will be kept open until next Monday, November 29th. Ranking Member Scott was pulled away a couple of times to other hearings. He will submit a statement for the record, which will be made part of the hearing record. And with that, we want to thank all who participated today, and this will conclude our hearing.